Hi guys, welcome to our YouTube channel Nursing Update. So this week we'll see the MCQs on medical surgical nursing. Okay, so due to some health issues I didn't upload properly in pediatric nursing, but in this week we'll upload the rest of the MCQs in pediatric nursing also. So this week we'll start with medical surgical. That too I'll start with oncology. Okay. So if you are new to our channel, please subscribe our channel. Okay. So let's move on to our first MCQ. Breast self-examination involves. Okay. Option A, inspection palpation of breast tissue. Option B, palpation of breast tissue and cervical lymph node. Option C, palpation of breast tissue and axillary lymph node. And option D, palpation of breast. Okay. So they asked what is mean by, okay, the terminology breast self exam BSc means what? Okay, that is the question. The answer is palpation of breast tissue and axillary lymph node. Actually, if you see the options, all the options getting apt to the question means breast self examination involves inspection palpation of breast tissue. It involves palpation of breast tissue except cervical lymph node. Okay, we won't see the cervical lymph node, only axillary lymph node we palpate and see. Okay, that's the only difference between these options. Okay, so the correct answer is palpation of breast tissue and axillary lymph nodes. Okay, let's move on to the next MCQ. Metastasis referred to. Okay, so usually if you have seen means if you have worked in oncology or any of the patient with cancer, they usually write TNM classification. Okay, T for tumor, N for lymph node, M for metastasis. Okay, so each disease they will write based upon the category, how much tumor is involved, how much lymph node is involved, how much metastasis occurs. So there is a classification is there. Okay, that is TNM classification. In that, M stands for what? Metastasis. What is mean by metastasis? Option A, bizarre cell growth. Option B, ability to produce the disease. Option C, spread the disease. And option D, transmit the disease. Okay, the correct answer is spread the disease. Okay, so you should know the other options also. What is besides cell growth? Cancer. Okay, what is cancer? Besides cell growth, the growth of cells will be in huge number. Okay, that is known as cancer. Okay, besides cell growth is cancer. What is ability to produce disease? Pathogenicity. Okay, ability to produce the disease. Spread of the disease, we already discussed, that is known as metastasis. Okay, transmission, you should know the meaning. What is transmission? Transmission is from one person to another person. Okay, so cancer is not able to transmit. Okay, suppose a person is infected with head and neck carcinoma or lung cancer or breast cancer, the person next to them will not get the disease. Okay, but it will spread inside them. Okay, suppose she is having woman is having breast cancer, there are chances that the disease gets metastasis to the bone, okay, or liver or lungs. Okay, that is known as metastasis. Okay, metastasis means spread the disease. Okay, then third MCQ, the nurse is teaching a group of new graduates about the safety needs of a client receiving chemotherapy. The nurse should administer bolus of IV fluids, administer pain medication, administer antiemetic, allow the patient a chance to eat. Okay, so what was the question? A patient is about to start chemotherapy, what do you do? Okay, so the answer is administer an antiemetic. Okay, why? Because most of the chemotherapy agents will cause nausea and vomiting. Okay, so prophylactically before starting any chemotherapy, they will give antiemetic. Okay, injection Emicit, injection Rantac, and injection Dexa. Okay, this is the common practice used in India. Okay, they will give each vial, okay, in mixed in 100 or 500 ml NS, and they will start as pre-medication. The pre-medication will be given as antiemetics. Okay, because 90% of the chemotherapy drugs are causes nausea and vomiting. Okay, clear with this? Okay, let's move on to the next MCQ. A nurse is preparing to administer chemotherapeutic agent via intraperitoneal therapy. In which position should the client before administering the drug? Option A supine, option B semi-follows, option C Trendelenburg, option D dorsal recurrent. Okay, so they are going to give chemotherapy in intraperitoneal. What is intraperitoneal? That abdominal cavity. Okay, so in that peritoneal they are going to give some drug. Okay, in CA ovary and all they will give that drug. Okay, so that it will cause a local reaction in that particular site. Okay, that is known as intraperitoneal therapy. So the patient is going to get intraperitoneal chemotherapy drug. Which is the position you should give? Okay, so position based MCQs, one of the most important MCQs. You can see any of the question paper, there will be minimum one question will come from positions. Okay, so options were supine, semifollow, Trendelenburg and dorsal recurrent. The answer is dorsal recurrent. Okay, so usually in dorsal recurrent we give because in dorsal recurrent position the abdominal muscles are relaxed. Okay, so it's easy to penetrate using a needle and it can easily inject the chemotherapy drugs also. Okay, so intraperitoneal therapy, the best position is dorsal recurrent. Okay, let's move on to the next MCQ. A client is hospitalized with the signs of transplant rejection following a recent transplant. Assessment of the client would be expected to reveal. Okay, so what they have asked, a patient is underwent bone marrow transplant, stem cell transplant, whatever transplant. Okay, they underwent a transplant. Okay, so they went for transplant rejection. Okay, what is transplant rejection? The particular thing which we have given, the body is not accepting. That is known as rejection. Okay, so which of the following signs are revealed? Okay, what is the sign we can expect it in the patient? Option A, serum creatinine of 1.25 milligram per deciliter, a weight loss of 2 kg in a day, urinary output of 50 ml per hour, and rising blood pressure. Okay, serum creatinine. What is serum normal value? Usually 1.25 is okay, acceptable. Okay, so option A would not be the answer. What is option B? Weight loss of 2 kg in a day. That is okay, somewhat okay. And option C, urinary output of 50 ml per hour. That is also okay. Okay, so minimum urine output will be 30 ml per hour, but they are producing 50 ml. That's fine and well and good. Okay, then rising blood pressure is the answer. The correct answer is rising blood pressure. Okay, so first sign to reveal in transplant rejection. It's not only in bone marrow transplant, you take any of the transplant, liver transplant, renal transplant or anything, the patient will develop rising blood pressure. Okay, so this is the most important sign which is seen in client hospitalized with transplant rejection. Okay, the first sign seen in transplant rejection is rising blood pressure. Okay, most important MCQ. Okay, so I will be discussing the MCQs on oncology which came in 2019 examinations. Okay, so I have taken questions only from 2019, whatever exam happened in that entire year. That year MCQs on oncology only I took. Okay, I didn't took for any books or I didn't make any MCQs. These MCQs are already asked in some exams. Okay, these are the MCQs which are asked in the exam. That's only I am repeating. Okay, so that's all about today's video. So if you love our videos, please subscribe our channel. Okay, like our videos. Okay, and do comment and share our videos to your friends. Okay guys, bye.